Good evening and welcome to everyone for being here on World Sight Day. For those of you who don't know me, my name is Jamie Alexanderson. I am the Senior Manager of Development at Fighting Blindness Canada. You'll notice that myself and my colleagues are not wearing masks, and that's because we were all double vaccinated and we have had a rapid COVID test earlier today so that we can all be together here in this safe environment. I'd first like to start by acknowledging the Indigenous peoples of the lands that we are on today. In Toronto, we are operating on the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. From coast to coast to coast, we acknowledge the ancestral territory of the Inuit, Métis, and the First Nations people that this land is their home. I would like to thank everyone for being here this evening. We are thrilled to see so many familiar faces. We actually have 2 TV screens in front of us and we can see all of you on the screen. It's wonderful. It's really like being in person. Well, we're here and we're on Zoom, but we're going to make the best of it. So thank you so much. We're also recording this live event so that we can share it with those who wanted to be here but couldn't. The next hour is going to fly by. We are going to have a wonderful question and answer period with Dr. Michelle Cayouette and Dr. Brian Ballios and our President and CEO, Doug Earle, followed by our video premiere. And then we will open the forum up for questions from all of you. So please engage with us. Turn on your camera and get those questions ready for later. So without further ado, I'd like to welcome my colleague, Anne Morrison, our Director of Philanthropy. Press that button.
Thank you, Jamie. I am so pleased to see all of you out there. Tonight is about you. You are the reason we are here. Thank you for being a part of everything we do at Fighting Blindness Canada. You are funding the critical research needed for discoveries and breakthroughs in vision research. Thanks to you, Fighting Blindness Canada is identifying and supporting research that has the most potential for treating blindness and restoring sight. So you are a hero because you are making all of this possible. And tonight we have the pleasure of introducing you to some more heroes. Before I pass the microphone over to our President and CEO, Doug Earle, I'd like to thank all of you for making the future so hopeful. Doug?
Great. Thank you, Anne, and welcome, everyone. It's so great to see you and that you're able to join us tonight. Michelle, I wanted to say thank you, first off, for your volunteer service. It's amazing to be on our board of directors and as our chair of our scientific advisory board. And I was wondering if you could help us understand the lay of the research land here in Canada and also the critical role that fighting blindness plays in funding research. Michelle?
Yes. Well, there's research status right now in Canada is very difficult. It's a very competitive environment. There's a lot of people fighting for a limited amount of money. So there's fantastic research being done in the country on all sorts of disease, from cancer to Alzheimer, diabetes, and so on. And as vision scientists, the cause we care about are vision research, and we have to compete for these funds. And so it becomes very difficult. We know that there's only about $21 million that's been given to vision research in Canada out of a total of about a bit less than $1 billion. So this means that we need additional support. We need other source of funding to carry out our work. And that's the work that Fighting Blindness Canada is doing, really, is really helping vision scientists across the country to do their work and come up with the fantastic ideas and develop treatments for blindness and other eye disease.
Thank you, Michelle. And I'm just wondering, what is the future of vision research? What's exciting you as a researcher and our chair of our scientific advisory?
Oh, there's a lot of exciting research going on. When I think about the future, obviously right now, I see at least 3 main areas. The first one being stem cell therapies. So this is very exciting because this type of research gives us the opportunity to reconstruct or restore vision rather than just preserving what's left to a patient. So there is a lot of hope that we can use stem cells one day and derive these stem cells into certain cell types that are lost in different disease, and graft these cells into the eyes of patients and restore vision that way. So that's one of the exciting areas of research. Another one, I think, is obviously gene therapy. Gene therapy is there's the first gene therapy that's been approved for an eye disease, for a form of retinitis pigmentosa, a rare form of retinitis pigmentosa, that we have the honor and the chance to have approved in Canada. So that's super exciting. And this research started over 20 years ago in very basic research of people working with viral vectors and trying to develop the recipe to put back these genes into people's eyes, and it worked. And now we have it in the clinic, and it's accessible, albeit for a very rare mutation, and very few people can have this mutation. But still, I think it's major progress that's been going on in the past 25 years or so. And so I think we can hope that more is to come for more mutations, for more types of disease. So I think gene therapy is definitely an exciting area of research. Finally, another area that I find particularly exciting is an approach to try to restore vision using the cells that are already in the eye. We have, I told you about the stem cells, but there's also other types of cells in the eye that we could take advantage of and either make them responsive to light using an approach that we would call optogenetics, or transform a certain cell type in the eye that we call glial cells, and transform this cell into a cell that is missing in retinal degenerative diseases, for example, a rod or a cone photoreceptor. So these restorative approach are different than grafting cells in the eye, because they don't require a graft, and they use the endogenous cell, and if you want, it's reactivating the regeneration potential of these cells that are already present in the eye. So that's another exciting area of research, although it's perhaps a bit less advanced than the other ones, but I'm super excited about this possibility that one day we'll be able to use resident cell of the eyes and make them restore vision.
Thank you, Michel. This is such an amazing time for vision research in Canada. Now, Brian, could I ask you, welcome back to Canada, and you've just come back from Harvard University. You've chosen to come back to country to support and launch your research career and your clinical practice. Why? Why did you come back?
Well, there's a couple of reasons for that, Doug. Thanks for welcoming me back to Canada. I'm really pleased to be back. One of the main reasons that I decided to come back is because there's so many Canadian patients in need of new therapies and new approaches to blinding eye disease, whether it be from acquired eye disease like age-related macular degeneration or diabetic retinopathy, or whether it be from genetic inherited eye disease like retinitis pigmentosa or Leber's congenital amaurosis. There are so many Canadian patients who need to see these advances in therapies and new treatments, and also new studies and trials for treatments come to them sooner. And I'm so excited to be part of a big part of my practice being a mission to bring those treatments to patients. One of the biggest reasons I was able to come back was through the incredible support of Fighting Blindness Canada, and together working with the University of Toronto and with the Hill family, and incredible efforts and philanthropy to help me get started in starting up my own research program. It's really been the kickstart that a program like this needs to bring new treatments to patients. So we're on the beginning of growing something really incredible here, something that I think will be useful not just for patients in Ontario, but all across Canada.
And welcome back, of course. I'm just wondering, knowing where you are today in your clinical practice, what do you think has been some of the amazing discoveries of vision research that have made it to the clinic?
Well, one of the ones that when I see patients every day in my medical retina practice, one of the biggest advances has been anti-VEGF therapies. These are molecules that we inject, drugs we inject now into the eye to suppress the growth of blood vessels. And this has been a game changer for how we treat conditions like age-related macular degeneration and some of the problems associated with vein occlusions or diabetic retinopathy. This is therapy which is helping hundreds of thousands of Canadians every year to help preserve their vision and prevent blinding eye disease. And these are medications which I give to patients every day in my medical retina clinic. Secondly, we're seeing the dawn of a new age of molecular therapies. We're seeing, as Dr. Cayouette put so very well, the actual clinical application of gene therapies, which 15, 20 years ago were in the imagination of scientists at the bench side. We're actually seeing them being applied to patients. And with the Health Canada approval of Luxturna for a rare blinding eye disease, RP65 associated dystrophy, we're seeing the hope that this will come to Canadian patients very soon. And so many dozens of trials going on right now for other genetic eye conditions. This is the beginning of an incredibly innovative and different time in ocular medicine.
Thanks, Brian. That's the role that our donors are playing in this amazing moment of time, allowing us to fund critical research, to accelerate the discovery of new treatments, and bridge to be able to help cure blindness. So now we're going to share with you some heroes of our community in a video that we'd like to show the impact of your support is making. And afterwards, Larissa, my colleague, will be joining us to lead a question and answer where you can pose your questions, and the panel with our two guests will be able to answer them. So let the video play.
I knew something was wrong. You could just tell from the doctor's face and their expression. And you never know what's good when you're getting rushed to Children's Hospital.
Hi, my name is Chase Henderson, and I am 9 years old.
Hi, my name is Ava Henderson. I'm 15 years old.
My name is Doug Purdy. I was diagnosed by my ophthalmologist with macular degeneration.
My name is Adam, and I'm 18 years old.
Well, my name's Jenna Brown. I'm 21 years old, and I happen to have an eye disorder called retinitis pigmentosa.
I have an eye condition called Stargardt's.
And it's where you lose the center of your vision, so it's harder to do certain things.
One day I was driving out to a site, and as the literature predicted, instead of the lines being straight on the road, they were curvy.
I'm pretty sure it was when I was young, maybe like 5 or 6, was when I first understood that I had a visual impairment.
It hinders my peripheral vision, my night vision, and my central vision. It's made it harder to read, to see things that are far away.
Being a teenager and having a visual impairment, there's definitely a lot of struggles. When I'm school is harder for me because I have to work a lot harder to get my schoolwork done on time because it takes a lot longer, and it's just a lot harder in Braille. Just knowing that I don't have as many opportunities as other kids, that kind of is hard.
Yeah, so when we were told, all the information came swirling at me. I just remember sitting in a chair like this.
And so all this negative thinking about what they won't be able to do comes. And so that it goes to the ideas of, what did I do in my pregnancy? The feelings of anger and frustration.
She would never drive. She'd never have certain opportunities for a career. And you're just looking at your 6-year-old daughter. Yeah.
just want to say that I would rather her have better eyesight than me because she has worse eyesight right now.
Vision is extraordinarily important in terms of just maintaining, high functioning lives. We rely so much on vision, and when that's lost, it has a tremendous impact, not on the people that are undergoing that, but also the families.
It's so profound, people's fear of losing their vision. And when you tell somebody that they are at risk of losing their vision, or that the vision loss that they've sustained is permanent, it's devastating.
Well, for me, to know that 1.2 million people are living with vision loss and 8 million Canadians are at risk of developing these diseases is stimulating to do more and really come in the lab every day with the motivation of helping these people. It's a lot of people, and often we forget there are so many people affected by vision loss.
One of the main things that we're trying to understand is so we have these genetic mutations that cause blindness, but what is the thing that the genetic mutation is actually doing? Why does that cause blindness? And if you know that, there's a way, potentially a way to intervene.
That by targeting the innate immune system, we will be able to slow down or even block disease progression.
Changes have been made over the last 15, 20 years that have been revolutionary. And we've been able to save an incredible number of people's vision over time, and it's getting better and better as time goes on, but there's continued work that needs to be done. And so that's where Fighting Blindness Canada comes in so importantly.
Why I feel very passionately about giving to Fighting Blindness Canada is, first of all, it's going to help a lot of children and seniors who are some of our most vulnerable populations. And also, what we have with vision research is an ability to specifically look at one genetic defect, one problem, and start solving them one at a time. And as we unlock one, the others are going to get easier and easier.
Doing research like this is absolutely a great privilege that we do not take for granted.
It really has a tremendous impact on the research and the future tools we'll have to prevent vision loss and save vision.
For us, it's the hope that one day we can find a cure that is going to give back Ava her vision and to stop any further progression for Chase and all of those that are living with this degenerative vision loss. It is such a hard process to watch your kids go through it. It's just so important to us that other people don't have to go through it, don't have to feel that pain of loss.
The work that Fighting Blindness Canada is doing is immensely important, and they're supporting the next generation of vision science researchers, and they're supporting the translation of new therapies to the actual patients who need them. They have an intimate understanding of the needs of those patients because of their role in patient advocacy, but they also understand the perspective of ophthalmologists and care providers who are trying to bring these treatments to patients, and they're helping everyone to navigate that pathway.
When I hear about advancements in research, I immediately think about my daughter having the privilege of having gene therapy as part of a clinical trial and the difference it has made in her life, where it has stalled the regression and has allowed her to have a better quality of life.
Because visually impaired people, of course, are extremely capable. They just need that little bit of support to get there.
And so what I've always really clung to in terms of Fighting Blindness Canada as an organization is it provides hope, and that's what these patients need.
Wow, that was wonderful. Thank you to everyone who we interviewed for this very special video and for sharing your story with us. That was really wonderful to see. It was actually the first time for me watching it as well. And I think now we are going to move on to a Q&A from the audience. So we're going to give you a chance to ask your questions to any one of us or to Dr. Ballios or Dr. Cayouette. So just so we can see you, can see if you're interested in asking a question, we're asking you to please turn on your camera if you're comfortable. And you can use the raise the hand button to ask a question, or just wave your hand in front of the camera and we'll try to get to you. And you can also feel free to type your question into the chat box. And if we don't have a chance to answer your question today, we'll be sure to capture all those questions and make sure that we get answers to you afterwards. So yeah, so start thinking of your questions, start sending them in. To start out with, we actually had a question from one of our participants here today, Gilbert. So Gilbert, if you want to put your camera on, we'll unmute you and you can ask your question.
Trying to put my camera on.
We can hear you, Bill. That's great.
We can hear you. We want to see you.
I'm in settings here, and why it doesn't start, I have no idea. Anyway, my question was about when are we going to get a significant progress so that it makes a difference in actual people. I understand that you want to start with the people who have nothing to lose. My two children have, they are kind of not that handicapped to 100% handicapped, so they are functional. But it would be nice to know when we can start finding hard solutions.
Okay, thank you. I'll ask actually both Dr. Ballios and Dr. Cayouette to answer this. But I'll start with Dr. Cayouette about what do you see about therapies that are coming up in maybe the sort of shorter term and some hope for patients, maybe with an IRD or other types of retinal degeneration.
Yeah, the when question is very common, and I totally understand people want to know when. It's very difficult as a scientist to give a timeline because we're studying really complex disease. So I'm very hesitant to give a timeline, but I'm confident that, we've seen, so if we go back in history, I was talking about gene therapy and how it took about 20, 25 years to go from doing experiments in animals and testing different type of approaches to you actually using it in patients. And people are receiving this treatment today as we speak. So I think this is probably the time frame we're looking for other conditions as well. And perhaps other types of approaches. Now, of course, we've made progress already in many of those areas, including stem cell therapies, and there are clinical trials going on right now with some of those approaches. So I would say we've done quite a bit of the road already, and so I'm I think we can be hopeful that for children today, there will be a solution for them. But I don't want to give a specific amount I don't want to say in 10 years, because what if, you come back to me in 10 years and you say, hey, you told me 10 years ago I would have a treatment. But I really think that, around that time frame, something will happen.
No, I thought that was a really good example of how long science takes. Dr. Ballios, do you want to answer the same question, or do you have anything else to add?
I'll just add that I hear this so frequently in clinic. Patients want to know, they want to know when these changes are, these
right now,
new
right?
therapies are going to come.
They can't hear you, right?
No, but
yes, we can hear you.
We can hear you.
Excellent. So patients ask me all the time in clinic, when are these new therapies coming, and how long should we wait? And Dr. Cayouette, I think he really hit the nail on the head. In the last 20 to 30 years, we've just begun to understand how many of these conditions in ophthalmology, what is the actual mechanism that they cause disease and degeneration. And the amount of progress we've seen in the last 10 to 15 years with taking therapies, new classes of medications which never existed in the history of medicine, and apply them to people and get new therapies that are actually approved by organizations like Health Canada and the FDA to treat humans with genetic eye disease. I mean, that's something that's never happened in the history of all of medicine. And so we're turning an incredible corner in personalized care. And we're entering treatments in ophthalmology to treat some of the most challenging ophthalmic diseases. You can think of it that much of the low-hanging fruit has already been plucked, and we're going after some of the most challenging disorders now, not just in ophthalmology, but in all of medicine. And I think one of the big things I look forward to as a practitioner and as a scientist is trying to provide patients with choice. We want to be able to provide patients with therapies that are going to be tailored, not just to early stage disease, but also to patients with who've lost a significant amount of vision. We want to give them choices, whether they be stem cell therapies or gene therapies or drug therapies and protective strategies. And adding all of those options complicates all of those pathways. And so I think the pathway for any individual to a new therapy is going to be very unique. And I share the optimism of Dr. Cayouette in that when I talk to young people with disease, I think they will have many choices for treatment in their lifetime.
That's really hopeful to hear. We have some more questions coming in, which is great. We have a question from Craig, and I think I will pose this to Dr. Ballios. If an individual has had multiple retinal detachments, is there hope for their vision to be repaired?
I think we can think of a case of multiple retinal detachments as another way that the light-sensitive cells in the eye can suffer an injury. Something that's not related to genetics, but in the same way can cause loss of those light-sensitive cells. And so just as we're trying to develop therapies to replace those light-sensitive cells or replace their function in the retina, I think that those approaches, just as they're useful for genetic retinal conditions or conditions like age-related macular degeneration, I think there's hope that they could also be useful for patients who've lost light-sensitive cells from retinal detachment as well. It's the condition of retinal detachment is much more common than some of the most rare genetic disorders, and so there's a lot of patients who need these new therapies.
Yeah, absolutely. Actually, my brother-in-law suffers from retinal detachment, so that question really hits very close to home there. I think this will be a question that both of you would be interested in answering. So I'll start with Dr. Cayouette. We had a question about if you had unlimited money, which is a pretty wonderful idea. What would you do with it in terms of advancing vision research and vision and treatments for vision loss?
Oh, there's so much that you could do. I would probably design viral vectors for every single mutations and have the capacity to fix any mutations that exist using novel technologies like CRISPR, for example. I think this would be perhaps something that is currently limited by money because it's very, very costly to develop these vectors for gene therapy, and we have a very small number of conditions right now that are either in the clinic or in clinical trials. So I think expanding this would be fantastic, and it will cost money. Another area I think that I would invest heavily on is perhaps biased because this is my area of research, but still, I can toot my own horns. It would be restorative therapies and trying to really get at the idea of reactivating the regenerative potential of endogenous cells in the eye. There are ways that we can do this. And it's actually, showing promises in animal models. But there's so much more that we need to understand before we can get this to patients. And when people are competing for money and there's not enough money going around, it's limiting their progress. And when you're limiting how much experiments and progress people can do in their labs, eventually it's also impacting how fast these discoveries can make it to the clinic. So everything is connected. If you slow down any one part of the research enterprise because of lack of funding, it's going to have an impact on all the other parts of the road to recovery. And so I think these would be the two areas I would invest in personally. But maybe
that was a nice broad view. You a little bit of tooting your own horn, but you got into gene therapy as well. So, and Dr. Ballios, how about you? If you had unlimited money, both as either a clinician or as a clinician scientist, what are some of the things that you think would be worth spending your money on?
So I wear both hats, and as a scientist, I have to agree completely with Dr. Cayouette. As having a lab of my own, funding to support, the new discovery science that we do in my lab to find new therapies for patients, is essential. But if I put on my clinical hat for a minute and I think about patients with rare disease, with genetic disease, or even with more common acquired disease like age-related macular degeneration that's more prevalent in our society, I think if we had more money, we would invest it in establishing centers of excellence, centers where we could bring these patients to be able to engage with the newest therapies, and not just therapeutic centers, but centers that are excellent in diagnosis. We recognize that there are so many patients with genetic disease who have not yet been able to establish a firm diagnosis for why they have their particular eye condition. That's because we still have so much more to learn about how genes cause disease. And, I think about a model of care where there's no patient left behind, and where we bring these patients back to the table to re-engage with them, discover how their disease is happening, and establish a center where they can come to have that work done and to bring them to new therapies. And that requires an integrated model of care, which is uncommon in ophthalmology, even in the modern age. It requires interdisciplinary collaboration between traditional retina specialists and ophthalmologists, between geneticists, between genetic counselors, between scientists like Dr. Cayouette and others who are studying the mechanisms of disease. A new model of medicine that doesn't exist yet. And I think if we had funding to put into that, we could move these therapies to patients even faster.
Well, that's a really wonderful idea, and it sounds like a really hopeful idea for not the distant future. So looking forward to hearing more about that. We've got getting lots of questions in, which is wonderful, but we'd like to hear it from you as opposed to me asking all the questions. So I'm going to be a little bit cheeky, and some of the people who have asked questions, I'm going to call on you, and if you feel comfortable, please put on your camera and we will unmute you and you can ask the questions to Dr. Cayouette and Dr. Ballios yourself. So we had a couple of questions from Mario Lapointe. So Mario, are you here? Do you want to ask your question?
I see Mario.
Yeah, I'm here.
Hi. I hope you don't mind me calling on you first.
No, that's okay. So I had two questions. The first one was whether you can provide an overview of the clinical trials that are currently undertaken on humans. That's my first question. And my second question is, what is the extent of the international cooperation among researchers? That is, if the discovery, for example, is made in US or UK, how fast can we apply or use it or apply it in Canada? So those were my two questions. Thanks.
That's great. I might split up the questions between maybe the first one, Dr. Ballios, you can start with, and Dr. Cayouette, if you want to start with the second one about the international cooperation. So Dr. Ballios, why don't you go first?
Sure. For me to list off all of the different trials going on, both in acquired and inherited disease, I could put together a lecture that would take well over an hour on its own to talk about all of those. If we think about genetic disease alone, where there are trials going on in X-linked retinitis pigmentosa, multiple trials going on in choroideremia, multiple trials going on in conditions like achromatopsia, multiple trials going on in other genetic forms of retinitis pigmentosa and Leber's congenital amaurosis. Multiple genes that are being looked at. Usher syndrome as well. There are dozens of clinical trials going on. Multiple companies are engaged in this space, and with the success of a therapy like Luxturna for RP65 disease, to borrow the stem cell phrase, there's been a proliferation of trials in the gene therapy space for these diseases. I've, as a physician, I've been engaged in as an investigator on several of these trials, and I can say that there's a huge international effort to recruit patients and to try to get the data that shows safety, primarily safety, and now with many of these trials looking at efficacy of these new therapies. I think that we are only seeing the tip of the iceberg. And just as Dr. Cayouette had mentioned in his previous answer to his question, the number of different genes that we're looking at treating for these conditions is growing all the time. And that's very important because there are patients who suffer from a broad variety of genetic disease.
That's great, and I think it's a perfect segue to the question about international collaboration. We actually have a number of questions of people interested in knowing how do researchers interact with each other and share knowledge and collaborate on projects, and how do Canadian researchers collaborate with other international researchers so that all researchers are moving vision research forward as quickly as possible. So Dr. Cayouette, if you could tackle that question for us, please.
Yes. Before I get into this, I just want to compliment what Dr. Ballios just said. Maybe if I understood correctly, Mario was looking for a database or somewhere to look for the clinical trials that are currently going on. And there's a website called clinicaltrials.gov that you can go on and that you can search for any disease of your interest and see what is happening right now in the clinical trials side. So in terms of the international collaboration, this is absolutely critical to any scientist around the world. And we all interact. And there is, I don't know why, but every time I meet donors, even here in my institute, when people come to visit my lab, I always get this question. So how do you know that something else is going on elsewhere? And do you try to hide your ideas? And no, quite the opposite. We're going to, well, in normal times, we go to meetings and we actually talk to each other a lot. And these meetings are happening when they're in person. We can have scientific discussion nonstop for for hours and hours, not only by listening to other people's presenting their results, but also in coffee lines and at just going back to your hotel and walking with the speaker and talking about their research and trying to see if there would be a possibility for collaboration. So we see what is happening around the world when people publish their results. So the results are published in peer-reviewed journals. So once the science has been evaluated, and a little bit like what Fighting Blindness Canada does for the grant evaluation, there's reviewers that will read the science and decide and see, okay, this is sound for publication. And the paper is then published and accessible to anybody around the world, including you. If you want to have access to this research, you can. And so we, as scientists, constantly look at the literature and see what is happening. I have in my inbox every week a long list of new articles that have just been published in subjects that I'm interested in. And I can go and read these papers and contact the authors and try to see if there's possibility for collaborations, for example, or if they've developed a new approach or a new tool that we would like to use in my lab. I contact them, and there is a lot of collegiality in the field. People, especially, I would say, in vision research. We are a relatively small community compared, for example, to people interested in cancer, where there's way more scientists. So the vision scientist community is a little bit smaller. And so we tend to stick together a lot and help each other. And so don't worry. what other people are doing around the world, we know about it. And if there's possibilities for interaction and collaboration, it's happening. And people really are doing it. I'm doing it. I'm sure Dr. Ballios is doing it in his lab, collaborating with people in Europe, in the US, in Asia. We do this routinely.
That's really great to hear. And we,
Michelle,
as Dr. Cayouette knows, we had some grant review panels today, and I sort of saw that firsthand. The scientists coming from different parts of the world, many of them knew each other for many years, discussing research, and really a very collaborative atmosphere, which was amazing to see. And also, Dr. Cayouette, thank you for pointing out the website, clinicaltrials.gov. I'm also going to put in a plug for FBC's website. We have a list of clinical trials. Specifically, we have listed all of the clinical trials for inherited retinal diseases, and you could also link out to clinicaltrials.gov to get more information from there. So if you want a more curated list, you can maybe check out our website at fightingblindness.ca. So I'm going to move on to another question from Rob and Penny Richards. If you are on the screen, I'm going to see if I can see you.
Yep.
There you are. That's great. So yes, do you want to go ahead and ask your question?
Yes, I guess I'm curious about the milestones that you have to pass to get something from an idea to a cure. And you mentioned that you get these articles in peer-reviewed research publications, but what do you have to do to get it from there to a cure, and who sort of shepherds these ideas through that pathway?
So I think this is a question that, that either person can answer. Dr. Cayouette, since you spoke up first, you will start the answer.
No, it's a very good question and totally valid. It is a complex. It's quite complex to navigate these different steps, if you want, to take a discovery into a clinical trial and eventually into use in the clinic. So first of all, the research is done in small steps. So each publication is not necessarily a discovery that is the end, and then we can take this into a patient. So there's likely going to be more publications that are going to happen after that initial one on the same topic to better understand, make sure everything is safe, make sure it works optimally. And so this is what takes a long time. And then once we have that, we work with technology transfer offices that are present in all research institutes and universities across the country. So, for example, in my institute, there is a tech transfer office and patent lawyers working there, and we can then first talk to them and see how we can take our work to more applied step of the research process, and they will help us to navigate this scene. It's certainly something that I cannot navigate on my own, but we have help. In all research institutes across the country have these type of offices that are there to help people to take their work to the next step. And then finally, you also need venture capital. So there's obviously taking a new drug or a new treatment into a clinic costs a lot of money, way more than what FBC or even the Canadian Institute of Health Research can afford. When we get to this point, there needs to be a very well-structured venture capital company that will invest into the project and believe in the treatment and help you take it really to the clinic. So that's usually how it works.
That's great. Dr. Ballios, do you have anything to add to that answer? That was a really comprehensive answer by Dr. Cayouette.
Yeah, Dr. Cayouette gave a great explanation of the preclinical development of new technologies. And after that handoff happens, I'll say that you start to engage an army of individuals who are involved in the clinical trial enterprise. At that stage, you have to organize data safety and monitoring committees. These are usually international panels that are going to watch the data of the trials as it emerges. You need to organize individuals to coordinate and run the trials for the patient visits and gather the data. And then you need to progress through a very proscribed and important series of trials. They usually begin in a small cadre of patients looking for primarily safety of any new innovative therapy in those patients. And if those important safety benchmarks are met, and at the same time, perhaps there's some inkling of early efficacy from those drugs, then that goes on to support larger studies that involve many more patients looking for the sort of signal in efficacy that is going to give regulatory bodies the confidence that a drug is not just safe, but really going to be more effective at actually helping to slow down any condition. And so that's a long process as well. There are many promising therapies that then enter the clinical trial process, and that process takes many, many years to go through because it's important to watch patients over longer periods of time and see, are these therapies safe for many months or even years? Are they going to be efficacious, and are they going to be helpful not just in the short term, but are they going to help patients for the many years of their lives that they need to have good and important vision?
Thank you both for such a detailed answer. I hope that gave you a little bit more understanding, Rob and Penny, about the process it takes to get through from sort of the work in the lab all the way through the clinical trial situation. So we actually have one person who has used the raise their hand function. So Sharon Cole, we'd love to hear from you.
You've taken me off. Oh, I'm unmuted. First of all, I just am so inspired by the session today. It's just remarkable, the work that's going on, and particularly to Brian and Michelle, two old friends that have been in the trenches and have the same energy levels and commitment and compassion that they've had since I first met Brian. You as a student, and Michelle, I think, just a little older. But I do have, and I love seeing all my old friends on the squares. Nobody's aged at all, except for Grant Duff, who I think is getting younger. Maybe that's the glass of red wine that he's having on the vine. But I did want to ask one question, because I mean, we're just emerging out of the pandemic, and probably one of the most challenging times for research. And I'm wondering if Michelle and Brian can tell us the impact that it's had on your research, and what is emerging now, if there has been anything that you've discovered through this process, other than it's just darn hard to get things done.
Thank you. I'm really jealous of your glass of red wine, Sharon. And, why don't I start this time with Dr. Ballios?
Hi, Sharon. It's great to hear your voice and hear from you virtually. I'll take that on. The COVID pandemic just has been challenging for everyone in any sector of research or clinical work. And I think at the beginning of the pandemic, in spring and summer of 2020, we saw challenges with getting patients to come to their appointments and being able to do that in a safe way before the vaccines were rolled out. But patients who are involved in clinical studies and trials are incredibly committed. And we actually saw that these trials, despite the pandemic, were able to continue in a socially distant and safe way. And we've seen some exciting data coming out of ongoing clinical studies for early efficacy signals in various genetic eye conditions. And I would say that the fears we had initially that this would stop the research enterprise in its tracks and we would fall behind a few years, those worries have not been borne out in reality. And we've been seeing presentations from industry-sponsored trials and from investigator-initiated studies that are very promising over the last 10 months. And we've been seeing some companies starting to sponsor move from phase 2 to phase 3 studies in their trials. The clinical study enterprise has been trucking along, and there have been major new findings in gene therapy and the sort of things we can do with CRISPR technology and gene editing, and also during the pandemic, the launch of the first in-human CRISPR study, which is a very exciting time. So we're still seeing innovation despite the pandemic, and as researchers, we have an obligation to our patients to make sure that they continue to understand that they're going to in the future have choices for therapy. And I know that Dr. Cayouette and myself are working very hard in this area.
Thank you very much.
Thank you. So I think we have time. I'm going to sneak in one very quick question. So Andrew, I saw that you had a question. So if you want to, Andrew Burke, if you want to ask your question really quickly, and we'll try to get a quick answer to it.
Andrew Burke.
You have to unmute, Andrew.
Oh, I think he's on mute.
No, I've
There
got
you
it
go.
now. Can you hear me okay?
Yeah. Yes, we can.
Great. Most or all of the treatments, the different research that we've heard about today, for the most part, is dealing with manipulating or introducing living cells. I know from my time working with FBC that one other area of research that has been discussed over time is, in terms of the retina, is retinal prosthetics. And I'm curious as to, Michelle and Brian, what's your view of the current state of research in that area? Does it show promise, or is it far less promising than using living cells?
Okay, I'm going to throw to Dr. Cayouette, but if you could give a quick answer, maybe about a minute, and then if there's something longer, we can, of course, get back to Andrew with a longer answer after.
Yes, absolutely. Andrew, I do think that prosthetic is the challenge was technology. So the technology was not quite advanced enough to produce an image that was useful, or is more like restoring light detection. Now we're talking about, with the advancements of new technology, we're talking about much, much, much better prosthetic being developed. So I am indeed very hopeful that this will be used, perhaps not by itself, but maybe also in combination with other therapies, or for certain specific conditions. But I do think it's a promising area of research for sure, and there's a lot of progress being done right now with this. So yes. Short enough?
That was amazing. That was
perfect.
it was so quick. I wasn't ready to say anything. I wanted to ask you a question because I felt it was a little bit different than some of the other questions we had. So I'm going to turn it over to Jamie now to wrap up. Yeah.
Oh, I don't want to leave. This has been so wonderful. And I don't know if I mentioned this, but we can see everyone who is on camera right now. We have television screens in front of us, and we can see all of your faces. And it's so wonderful to see so many familiar faces. So please, write your questions in the chat, because I promise that we're going to save them, we're going to keep them, and we're going to answer them, and we're going to get back to you. So please write your questions in the chat, and we will get those answered. And we're going to wrap up now. And I just want to thank you all so much for being here, for being a part, sharing your evening with us. All of us at Fighting Blindness Canada welcome the opportunity to engage with you, reach out to us. Please feel free, and we can talk about different ways that you can get involved with Fighting Blindness Canada and continue that conversation. So thank you. Good night. Have a lovely evening, and be safe and take care.